So I'm with Madeleine Hahne in Abu Dhabi. Madeleine, tell us about the impact of COVID-19 where you are, and in particular, its impact on your church community.
For my faith community, the church generally concluded early on when this started, and I think partly this is aided by the fact that the prophet of the church is a medical doctor himself. So they take things quite seriously, which is fortunate, that nobody would meet in the entire world. It would just be a total kibosh on people having congregations, and that missionaries would be sent home to their home countries where possible. And so in essence, things sort of ground to a halt.
And so what has that meant for members of the church? You're presumably in touch in the whole region, not just in Abu Dhabi, and you're in touch socially, but also what about spiritually and in terms of religious practice?
So the church tends to be extremely community focused. In fact, the symbol of the church is a beehive, because bees all work together as a community to achieve a common goal. And you'll see that all across Utah. So the impact in this region, which is very interconnected with each other religiously, so the members of the church in Saudi Arabia and in Qatar and in Oman all fall under a similar umbrella. I had planned events like conferences for young adults and other major events that would gather us all together, and these all had to be ended or stopped. But I think that it has, from what I have seen, been both a challenge and a blessing for people in this region. It has been a blessing in that almost everyone is connected to the internet and able to speak with each other, and we've established very quickly Zoom groups or other forms of conversation to have what we call devotionals, or to have speakers from the church headquarters or regional speakers. So I think in the past few months, I've had 6 or 7 different church meetings on my computer. But the challenging part is, because we are a community-focused church, where on a normal world pre-pandemic, we would meet probably 3 times a week for various activities and events, it can feel very, very isolating. And I think people have been quick to try to adapt to the technology as a way to find each other or to feel connected to each other.
But of course, technology only allows you to be connected in a certain way. It goes so far. Yeah. Are you able to reach out to other communities and your neighbors? I mean, obviously Christians and members of the Church of Jesus Christ of Latter-day Saints are always going to be a minority in that part of the world. So how is it working in terms of the ecumenical, if you like, but also the interfaith? Is there any activity at all, or has it just ground to a halt?
On the congregant level, there hasn't been any activity between faiths, but at the higher level, so each congregation there's a bishop in charge of that congregation, so they only cover a few hundred people, as opposed to a Catholic bishop, which covers a large area. And then above that is a stake president. At the stake president level, which is a sort of a regional level, there has been communication across the Christian communities, because they're working directly with the government and trying to decide how and when it's safe to start opening up once again. But that hasn't been distilled down to the local populations at all. Part of the issue is that the pandemic has concentrated pretty heavily among the migrant worker communities here. So this country is 85% immigrant. And that immigrant, that's from people like me to people who work as security guards and coming from countries all over the world. And many of the people who are working at jobs like security guards or construction workers live in worker camps, where there is very little, it's very difficult to find privacy. And so a lot of the pandemic has been concentrated within those communities. And our church has many members that come out of worker camps. And so it's particularly difficult to just restart because there's such a high risk relative to if we had a community solely of people who were staying at home and had office type jobs, they'd be less likely to be infected. So I think right now I've heard much about conversation that they're having on whether to reopen and how to reopen, but it's still too much in flux to have any kind of certainty.
So what's been the biggest challenge or challenges that they're facing? Is it in terms of life events such as funerals or weddings? Is it in terms of isolation and feeling, the sort of the challenge of mental health issues and so on? What's been the biggest challenge as far as you know?
I think actually for our community, it has been, because there's such a large population of people from the worker camp communities, it has been day-to-day survival, because many people have lost their jobs, which is true across the world. And in many cases, it's difficult for them to return home due to the issues with the flights. So as a community, we've gathered together quite a lot to help people manage getting food or finding a new place to live if they lost their home. And so I think the focus is definitely there. We've had to stop completely with baptisms. We've had to stop completely with any kind of community event at all. But I think that's become secondary to just the general ensuring that every member of the church is cared for and that no one slips through the cracks.
You worked for some time for a peace NGO, Tracks of Peace, and what impact has COVID-19 had on that? Has everything ground to a halt? Does it provide an actual opportunity because we've been stuck and have more time, or is it resulting in greater challenges because of the you've just said, the need just to survive?
Yeah, that's a very good question. It certainly made everything pivot. Initially, we were planning, for example, on working in Zambia on helping people who are suffering from PTSD to recover from that through a program which would not require the use of highly trained psychologists and psychiatrists because they're not available. So it was about training people who are laymen to be able to work with PTSD victims and help them overcome that. But that we essentially had to stop working on that because it's the entire medical community has reoriented itself towards COVID. However, we are now looking toward potentially doing something more around COVID, because that can create its own traumatic stress. And even though that's not necessarily peace and conflict, it can contribute directly to international conflict, and it certainly contributes to trauma, and trauma is something that we're very interested in. So the question is whether we can, and what we're trying to work at now, is whether we can institute these programs through non-face-to-face contact, whether you can actually help somebody overcome trauma on a computer as opposed to sitting in a room with them to overcome it, right? And so until we surmount that particular obstacle, we're waiting to try to suss it out. But part of it is being willing to slow down in the conversation and listen much more carefully, because you are limited. Your cues of how people are feeling are so much more limited than they were previously. So it requires many more clarifying questions and less expectations to move forward quickly. But that allows you to develop the personal connections and understanding necessary for true revelation to occur.
And in fact, as we draw to a close, that's something you can carry forward, that sense of the patience, the clarification, when we do return to the physicality once this pandemic has passed. Thank you very much indeed.
You're very welcome.